Thank you for the opportunity to participate at this conference and my sincere gratitude to you for making it happen in this rather challenging year. In this presentation, I will talk about the history of the Bowen Technique and the development to date. We will explore the role of Bowen Therapy in conception, pregnancy, childbirth, and postnatal, as well as in the newborn. We sometimes call Bowen Therapy the alternative to the alternative therapies. It is a gentle, non-invasive form of bodywork that stimulates the body to heal itself. The depth of the impact a Bowen move has is yet to be fully explored. In recent years, there has been more interest and focus on connective tissue and the role in the body. Therefore, more information is available with regards to communication pathways from the body to the brain and vice versa. People always ask how this therapy works, so I will talk about what happens in the body when making Bowen moves, and we'll talk more in depth about fascia and the connection to Bowen therapy. There are common issues involved with pregnancy and delivery. Supporting a pregnant mum during her pregnancy may assist with oxygenation and keeping the mind at ease due to the rebalancing of the autonomic nervous system, and of course it may assist with other common symptoms. When we look at labor, the non-invasive application of Bowen moves greatly assists with relaxation of the pelvic floor and a smooth delivery. When technology is needed to assist with delivery, or a birth has been very fast, resulting in shock, for instance, Bowen is indicated to assist the mother and baby developing the homeostasis or rebalancing. For instance, a forceps delivery may result in digestive problems and neck restriction, such as torticollis. With a few minimal moves, this can be corrected. Ventouse may result in distortion of the condyles and around the temporal area, which then has a direct effect on the temporomandibular joint, the hard palate, and the bite. That can develop into postural issues in later years and effects to the major cranial nerves, including the vagus. The Moro reflex that is overexpressed indicates that the sympathetic nervous system is generally overactive. This also is quickly resolved by minimal Bowen moves when addressed soon after birth. We can see that the way a baby is born has a great impact, not only in the early stages of infancy, but sets the body up for life. The trauma of a birth, may it be normal or complicated, is part of the cellular memory. We might say that every experience from conception to now, wherever that may be, what age that may be, is stored and in the cellular memory, a bit like data stored on your computer. There are many layers to this that impacts physical, mental, and emotional health. One of the fascinating effects of Bowen therapy is the unraveling aspects of events. Often we hear from clients that they experience symptoms they had, for instance, 3 years ago. Instead of thinking they get worse again, we assure the client that this is indeed not the case. Instead, the body unravels the events, meaning the memory comes to the surface of consciousness to be released. Once an event has been released, the body can make the necessary movements to come to a more balanced state. This is observed commonly in practice and is always an interesting aspect over a series of Bowen sessions. As we don't know what is going to surface, no client is ever the same. We can see that we are indeed all unique, although seemingly alike in physiology. There is a never-ending exploration of individual experiences, and it is very clear that even though procedures are used regularly and on most clients, every client's reaction and journey is different and unique. The sooner the balance is restored, the less compensation needs to be done. Therefore, very little treatment is needed for a baby or young child. The older we get, the more compensatory issues ensue and the more treatment is needed. Bowen is at its best when given as soon as possible after an event such as birthing and after injury. However, it is not restricted to acute trauma. Any situation that involves a heightened level of sympathetic nervous response justifies a Bowen treatment. When we look at preconception, for instance, there's a lot of stress and anxiety in the mix. Going through assisted conception can be highly stressful for both partners. Unfortunately, stress is not helping with conception. Supporting both partners through this stage may greatly assist with relaxation and peace of mind. There are treatment plans available for couples to assist in a complementary manner. Needless to say, there are other elements that are important to address, such as lifestyle and diet. Preparing the body for pregnancy should ideally be a well-planned event, which includes detoxification, exercise, mindfulness, and a healthy weight. For those who are qualified to give advice, this is a very useful addition to the protocol. We will hear about tissue memory, pathways of impulses given through fascia, conductivity, and amplification of Bowen moves during treatment. The embryonic development will be discussed in connection to the blueprint. What is the blueprint, and what does it have to do with Bowen? There are many open questions that need answers, which are to this day not fully explored. I will attempt to connect some dots to help with the understanding of cause and effect. Fascia covers the body from the toes to the head. Having a clear highway is key to uninterrupted communication. Misalignment such as leg length discrepancy may be related to other areas in the body, such as the pelvic or the TMJ areas. Therefore, a Bowen treatment involves the whole body. When there is an injury from accidents or surgery, there are interruptions in the flow due to formation of scars. Scar tissue has an impact on how Bowen moves affect the body, and we will talk about how Bowen can be implemented successfully and why. I hope you enjoy the conference and gain a little more insight into the mysterious world of Bowen. Thank you.